A very thoughtful panel discussion on the Renaissance in neuroscience, why and why now, featuring Vikram Ingle, Group Product Director, Schizophrenia Market Access at Johnson & Johnson Innovative Medicine, Cindy Schwartz, former VP of Marketing at Karuna Therapeutics, and William Laub, Vice President for Strategic Initiatives, PRMA Biopharma, Indegene. So please join me in welcoming them for that panel discussion.
Am I on now? Mic from? Okay. So, sorry, we were just getting mic'd up because they wanted to throw a curveball at us. They had us originally coming in after the break and trying to wake you up. Now we have to keep you awake to the break. So I apologize a little bit for the change in the move from left field. But my name is Bill Loeb. I'm a vice president here at Indegene. I've been given the honor of getting to moderate this session where we talk about important changes in technology because we haven't done that enough today. But today we're going to talk about, in my group, neuropsychiatry and the changes that are happening in that market. Because what's going on is a new revolution, and so we want to take a moment to talk about that. Because if you think for a second about prior revolutions in neuropsychiatry, you can think about the late 60s, early 70s. We developed psychedelics, we developed harsh treatments for schizophrenia, new developments as antidepressants. Then we moved into the 80s. We had the first real revolution after that, where we had Prozac come. We had the atypical antipsychotics come. Clozaril first. Clozaril was a great drug. And then we moved into the other atypicals like Risperdal. And now we're on a third wave, where literally we see real need in mental health, and we're moving it forward into looking at novel treatments and really expanding the opportunities. And so I wanted to take a moment and invite Vic and Cindy to really talk about what they're looking at their companies, and then we'll talk about how that moves forward in the future.
Hi, nice to see everybody. My name is Cindy Schwartz. Bill said he was going to maybe ask us what we've worked on. So I'll say that I have been in primarily the marketing field for the past 20 years, and most of the products that I've worked on have been in the CNS psychiatric space. The most well-known of that was Vraylar, which I think you see advertised on TV every 7 minutes or so. And, and I launched Vraylar about 10 years ago for 2 smaller indications, bipolar mania and schizophrenia. Now that's a very large drug with multiple indications. My most recent role was at Karuna Therapeutics, which is a company in Boston some of you may have heard of. Karuna developed the first new treatment for schizophrenia in over 7 decades. And as Bill said, I think we're starting to enter this third renaissance, and so that drug was called KarXT, now it's known as Cobenfy. That's actually just started advertising on TV this week, so you probably have seen that too. And so that was my most recent role, and I think we're excited to talk today about where things are heading from here.
Thanks, Cindy. It's a pleasure to be here. My name is Vic. I'm Vic Engel. This is one of the first panels I've done, so thank you for that. Whenever I say something silly, please feel free to laugh. It would make me feel really happy. So I've been with Johnson & Johnson Innovative Medicine for about 15 years, and I've had a couple of different phases, different chapters. The first chapter was all about, in our consumer sector, working on data agreements in the procurement space, so quick shout out to my procurement friends over there. The second chapter was in the M&A space, thinking about our organizational strategy for acquisitions and divestitures. And then the third phase has been as chief of staff to the neuroscience president, working on our franchise strategy for neuroscience, and now just most recently moving into the market access space in schizophrenia. So really thinking about the neuropsychiatry landscape and where we need to evolve from that perspective. And I think the most interesting part of this entire journey is how different neuropsychiatry is from a patient perspective to everything, all the other places that we've seen and we talk about. So maybe just a little bit of audience participation. Show of hands for the number of people that have worked in neuropsychiatry or CNS. Very few. No, show of hands for how many people worked in oncology. It's like everybody, right? So and those other people were just not paying attention. So that's fine with me too. So it's a different space, and that's what we want to talk to you guys about. My other goal is to try and not say AI a lot today, so you've been hearing about it all day. That's my last goal.
Great. So we're at the beginning of, or in the middle of this renaissance. It's been a renaissance that has really come about as of some societal level causes, and we've looked at new ways of treating and assessing. So you've seen an explosion in telehealth and other situations. But now that we move into the new treatments that you guys are working on and touching, what are you seeing as the scientific challenges, the social challenges, and the systemic shifts that might be facing companies today?
I can jump in. So first of all, this idea of a renaissance, I love that Bill had set up the question about these different domains, right? Structural and systemic, social, scientific, because I think what is happening is changes in all three of those domains at the same time as really allowing the new innovations that we've been seeing. And I can start by touching on the social side. In terms of social shifts, I think everyone can probably think of examples in their own life where I think we see every day that the importance of mental health and prioritizing mental health and mental health challenges have been getting so much more awareness, more conversation, less stigma. Vic and I were talking before about how that is particularly true for anxiety, depression, OCD, some other very important mental illnesses, but not as much in the severe mental illness or SMI side. Although I think we are starting to see a little more of that too, with, for example, on social media, there are personalities in the schizophrenia space who show their lives. Sometimes they show live like what it's like to experience a hallucination. And these are things that give a real window into the challenges that people with these various conditions are facing. And I think that one element of mental health that's really, really interesting is the unmet need, because it's very, very high by a lot of different measures. But I think some people may be surprised that the toolbox is quite full. There's actually a lot of treatments out there. Some don't work for some people, some have very serious side effects. And from a physician perspective, we often hear doctors say, I'm good. Like, I have a lot of atypical antipsychotics for schizophrenia, for example. I know how to manage the side effects. But from a patient perspective, 30, 40 pounds of weight gain may not be manageable and may really disrupt your life. And so some of these social shifts, I think, are especially impactful because if there's more awareness, less stigma, more conversation, it can shine a light on this unmet need, and people are demanding more, like things that work better, things with better side effects, and it's sort of less in the shadows than it used to be and more out in the open.
It's a great way to put it. I think you said it well. The toolbox exists, but it's not great. What's really driving some of this renaissance, though, Bill, to your question, I think, is the investment that companies are making in precision psychiatry. So some of our R&D colleagues would say that we expect this space to look like oncology does in the next 10, 15 years, right? It's not going to be as precise. The psychiatry diseases are not as well-defined, and the space is not as data-driven as oncology or some of the other places that you're familiar with are. But it's going to grow by leaps and bounds in that space, and will allow us to have more data-driven conversations with the HCPs in this space. And then the renaissance part, I just want to touch on one thing, because I think it's a stat that not everybody knows or fully has embraced. So we are seeing destigmatization continue. But is everybody familiar with Cheerios, the Cheerios box? You know that big picture of a heart that's on the Cheerios box, right? We're all familiar with that picture. Did you know that 1 in 2 people globally will have a diagnosable mental illness? 1 in 2 people. That's more prevalent than heart disease. That's more prevalent than cancer. So my question is, where's our Cheerios moment, right? That's where we want to be. We want to drive that destigmatization in a way that says, hey, this is an okay thing to talk about, and we are ready to make change in the world. And that's what's going to drive the renaissance. And you're seeing it, right? So in 2024, one of the biggest, second only to the oncology deals, was neuroscience, the neuropsychiatry space. And it was actually the BMS acquisition of Karuna that drove that deal cycle. So investment is coming into the space as well.
Definitely, and I think the space is also trying to shift to accommodate that growth, right? We see situations where treatments that were unheard of possibly being employed, like psychedelic therapy, are now things that are becoming much more possible. There's approval pathways for them. You see brain-computer interfaces as a thing that's advancing, prescription digital therapeutics. You see your advances in the antipsychotic spaces. You see growth and potential in Alzheimer's and other neurodegenerative diseases. So talk a little bit about what you think the system has to do to accommodate some of those changes that are coming.
Some of the things that I find most interesting about this are sort of the logistical and practical considerations on what are going to make these things from sort of ideas that are very exciting to realities for people, first for companies to implement, doctors to integrate into their practice, and then patients to actually be able to access. And one of the earlier panels was talking about things that are sexy and not sexy, and I was thinking that reminds me of this because I think it depends what kind of jobs you like to do, but I love the idea of working at a company with something new and thinking like, what are the old ways of doing things that we need to hold on to, but also what are the new things? And I guess maybe one example of that from an industry perspective is how do you structure your organization? How do you structure your sales force and perhaps your training organization if you have a treatment that is going to require new skills from physicians or from your representatives? And then there's totally new things, and I think industry is one side, there's regulatory, there's physician, there's a lot of things, but I think a lot of them are sort of the minutia about how you're actually going to implement.
I think the other side of that, and you talked about organizational strategy and capabilities, which I firmly believe. I also think that there's going to need to be a larger ability for our HCPs and thus manufacturers in order to educate on the data sets, the things that are proven, the things that hold merit, and actually drive to both clinical decision, but clinical outcomes, right? And I bring that up because we've seen a proliferation of mail order pharmaceuticals. We've seen things that are not as proven, right? But people have, in the spirit of destigmatization, have said, hey, this really works for me, right? I'm gonna butcher the stat, but the amount of misinformation around ADHD that's circling on Instagram right now is astronomical, right? Like it's just unbelievable amounts. So the question is, what skill sets and capabilities can we use as manufacturers, as industry, to really shape that conversation in a way that's driving towards the data and then influencing the right conversation, both with the patient, provider, payers, right? Anybody in that landscape that affects a clinical decision and a clinical outcome.
Let's talk about that mountain of misinformation, and I'll segue into how do we combat that so that patients and caregivers engage in the right way with therapy, with physicians, with telehealth, whatever avenue they're choosing, so that we're making sure that they're in the right way. And, going back to what Tarun talked about with making sure that the AIO pulls up the right information, where do you think those initiatives go to make sure patients and caregivers are engaged with, at the very least, facts that support appropriate decision making?
Well, I think it starts with education. That's something that companies can do, and it also is the HCP should be right the main channel of communication with the patient. We were talking about DTC earlier. I mean, a lot of this starts with awareness, and DTC. Well, there are challenges and there's our opportunities too, and it is effective, but it's also effective in educating people and raising awareness about different products. So I think those are all things. Like keeping the channels of communication open are sort of like the first thing you have to do.
I forget where we said it this morning, but trust, right? So trust is so important. It's paramount that we live into the guidelines that are set by organizations, live into the regulatory needs, but also make sure that we are just continuing to build trust between our organizations and the providers, payers, everybody in the landscape.
You bring up payers, so I'll use that as a segue there. With regards to access, thinking back 5 years and thinking forward 5 years, do you think payers have kept up with access and prioritization of mental health, and do you think they will keep up, if they have already, moving forward 5 years?
So I think there's a lot of shifts happening in the space, Bill, and you know this, having been in this space as well. So we continue to have 6 protected classes as part of Medicare, Medicaid, which basically means that there shouldn't be any utilization management, right? Except there's prior authorizations that allow patients to get onto the medications that they need to get onto. And we're starting to see more and more class management in this space. So to me, that's going to and because of the investment and the amount of innovation that's coming into the space, it's going to start to make payers say, hey, wait a second, I've not been managing this category very well. I need to start managing it because it's now becoming more and more expensive for me, right? Which is a good and a bad because they're starting to take notice, but it also that means patients that do need certain treatments aren't going to get certain treatments. And so my answer is we're going to start to see an evolution in that space that to me is going to look more like some of the things that everybody's used to of pathways, right? Like guidelines being adhered to and some of the challenges that we see in other therapeutic areas. And that's my plug for people who have experience in that place. Come help us make sure that neuroscience continues to have the green and open access that we need to continue to have for our patients.
And also getting data on outcomes and real world evidence, those are things that have been growing, to your point about the last couple of years, growing, and it will continue. And we were talking about all these new things that are coming, and some of them are really out there, like they're very different, and how you structure a trial to measure outcomes for some of these will be really, really important.
What about the growth and the explosion of growth in telehealth and the potential for at least certain therapies to go into a direct-to-patient model, even if it's through something like a Ro.co or something like that? What do you think of those possibilities as expansion to both diagnosis and treatment?
Yeah, so telehealth, I mean, first and foremost, I guess, right, is just an access accelerator, especially parts of the country. I don't know the statistics, but I was always surprised to hear about how difficult it is to get into a psychiatrist or even a psychiatric nurse practitioner in many parts of the country.
67 days.
Is that right?
To get to a psychiatrist.
So yeah, that's really, really striking. So telehealth just literally opens the door. And when you think about like how important reimbursement is, it wasn't that long ago that telehealth was new, and it was very slow to get going because it wasn't really clear how to get through some of the regulatory hurdles, the privacy hurdles, and in particular the reimbursement hurdles. Like, how do you get paid for this? And now that you solve the reimbursement, you see the model taking off. I think the second part of that question is like a lot stickier, because this idea of like, it's almost like self-treating. It's always important to have a doctor involved. I think mental health, there's a lot of other dynamics at play too. But I think maybe the bottom line is that people having access to more options that they can consider whether are right for them and their families is the most important. And if that helps with that, that's probably a positive.
Yeah, just simply, I think there's some therapies for which the direct-to-patient and telemedicine are sufficient, and some where they're not. For example, like long-acting injectables or interventional treatments.
Thinking ahead now 10 years, right? We have this revolution. How will we have seen if we've been successful, right? What would you say is a success for how the market's changed and reshaped, and how do we effectuate that change?
We're talking about access and about how these innovations are sexy and exciting, and I think maybe the biggest measure is, are we able to actually implement these new modalities, new therapies, get them to patients, and part of that is having them paid for properly, also getting them through the regulatory approval process, which can be tricky when things are new and different than they used to be. But I think that, maybe I'll say two things. I think the main measure is people actually having access to these things that help them. And then the second piece, sorry, I think I'm going to blank on the second piece of that. You go and I'll try to remember that.
So I think there's a couple of sort of semi-obvious ones to me of which we talked about in the beginning, right? So stigma reduction, conversations about mental health are more in the regular vernacular, but also about more serious mental illness, right? So we talk about depression and we talk about anxiety and ADHD, but schizophrenia is a real burden for people, for families, for communities, right? So that's one way that I'd love to see in 10 years we're talking about this more effectively. The second thing that I'd like to see is that the conversations, and if you've ever worked with psychiatrists in general, right, there's a lot of learned behaviors that help them understand what works and what doesn't work. I'd like to see us move towards a place where the data is really driving the clinical decision making, because I think that's really which means we have data that really shows that the clinical decision outcomes are there. And then the last comment I'll say, and this is my plug, is I'd love to see everybody's hand up in this room that says, yeah, I'm working in neuroscience, right? I'm working in schizophrenia, serious mental illness, and combating some of those spaces.
And I'll add one more thing, which is that's a really important point about the serious mental illness, and that there are a lot of conditions that are either not really treated today or treated very suboptimally, where a totally new way of treating would be really important. And some of the things that I think about when I think about that are PTSD, where there, like SSRIs are used for PTSD, but like fundamentally there really needs to be a different approach. And right now a number of the psychedelics are being examined in that area. And I think that's really exciting. So when I think ahead 10 years, having treatments for things that you just are not treating very well today is a really, really big one. And I know there's some rapid acting antidepressants, but you think about a world where instead of, in general, most people having a treatment that takes 4 to 6 or more weeks to work, and instead could work in a couple hours or a day, would make a huge difference in things like suicide rates and really make a huge difference in people's lives.
So treatments, access to those treatments, and physician and patient awareness of those treatments and the truth around them is key. We are at time. I don't know if you'll want me to take questions or not, or if we want to move to break. I know we delayed break just a little bit, so they've added 5 minutes for questions, I think. I'm not sure, but yep, they added 5 minutes for questions. That's my signal. So if anybody has any questions, I will be up front that we did kind of remove some policy issues from this, so we may skirt some of that if you ask a policy question, but we will try. Mostly because the policy winds just keep shifting around mental health. And so it's, how do you answer that when you don't know what the future is? Barring no questions, everybody can have coffee, tea, and espresso, I think. I'm not enticing you. All right. Thanks a lot, everybody. Thanks to Cindy and Vic. Great time. Thanks.